Here we will discuss about Guillain-Barré syndrome. Guillain-Barré syndrome is an autoimmune attack of the peripheral nerve myelin. The result is acute demyelination of peripheral nerves and some cranial nerves, producing ascending weakness with dyskinesia, inability to execute voluntary movements, then hyporeflexia, then paresthesia, means numbness. So Guillain-Barré syndrome is an autoimmune attack of the peripheral nerve myelin. So your peripheral nerve myelin is attacked by your own immune system. So your own immune system is attacking your own peripheral nerve myelin, because the nerve is covered by a myelinated sheath. So this myelin is attacked by your own body immune system. That is autoimmune attack of the peripheral nerve myelin. So when there is an attack by the autoimmune system, what will happen? There will be acute demyelination of peripheral nerves and some cranial nerves. So your nerves myelination will go. There will be demyelination. There will be damage of the myelin of peripheral nerves and cranial nerves. Once there is a damage for the myelin of peripheral nerve or some cranial nerve, it will produce this nerve cannot conduct or work properly. So there will not be any proper conduction of signals or message or anything. So it will create lot of problems. As you know, the myelin is the covering of the nerve. There is a myelin covering on your nerve. So if this myelin helps for the conduction of message or signal from one part to another part. So in this case, because of autoimmune attack, your myelin is damaged. So there will not be proper conduction. It will affect your peripheral nerves and some cranial nerves, and it will produce lot of problem. What is that problem? Ascending weakness with dyskinesia. Ascending weakness means it is like from 0 to 10. It is from the bottom side to top side. Okay, it will ascending. It will from 0 to 10, like it is ascending type of weakness you can see. Then dyskinesia means inability to execute voluntary movements. You cannot do voluntary movements. Ascending weakness means from leg it will start. This weakness will start on your leg or your lower extremity. Then it will spread and it will extend and it will come upward. Then you will have weakness on your abdomen. Then you will have weakness on your respiratory muscles or chest area. Then you will have weakness on your face, etc. So it is ascending type of weakness you can see. Then hyporeflexia the reflex will be decreased. So hyporeflexia will be there. Then paresthesia, numbness will be there. Predisposing event. Normally after some infection, patients are getting this Guillain-Barré syndrome. Example, respiratory infection, then infection with Campylobacter jejuni. It is a gastrointestinal infection. So after infection with the Campylobacter jejuni, patients are sometimes getting this problem. Then vaccination, pregnancy, surgery. These are some of the predisposing event, because we don't know what is the actual cause. So there are some risk factors, that is respiratory infection with Campylobacter jejuni, vaccination, pregnancy, surgery. Pathophysiology. Infectious organism contains an amino acid that mimics the peripheral nerve myelin protein. As you know, your peripheral nerve myelin is made up of some protein, an amino acid. When there is an infectious organism, suppose one infectious organism, suppose Campylobacter jejuni, is in your body, what is happening? This is having some amino acid. It is similar to your peripheral nerve myelin protein. So this infectious organism is having some amino acid which is very similar to your peripheral nerve myelin. Our immune system or your body's immune system, it cannot differentiate which is infectious organism amino acid and which is peripheral nerve myelin protein, because both are exactly same. So what is happening, they actually your body is going to destroy the infectious organisms, but but your body is thinking that peripheral nerve myelin is that infectious organism, because peripheral nerve myelin and infectious organism containing same type of amino acid. So instead of attacking infectious organism, your your immune system will go and attack your own peripheral nerve myelin. So what will happen, this peripheral nerve myelin will get damaged and destroyed, then it cannot do the nerve conduction. That is the pathophysiology. So infectious organism is having some amino acid which is exactly same like your peripheral nerve myelin. So your body is thinking that your peripheral nerve myelin is an infectious organism and it is going attacking. Instead of attacking infectious organism, your immune system going and attacking your peripheral nerve myelin. Then this peripheral nerve cannot do the nerve conduction. That is the pathophysiology. If you see the clinical manifestation, Guillain-Barré syndrome begins with muscle weakness and diminished reflexes of the lower extremity. So muscle weakness will be there and diminished reflex of the lower extremity. Hyporeflexia and weakness progress and may result in quadriplegia. So this weakness is first develop in the leg or in the lower extremity, then it will extend to upward. Then there will be quadriplegia, then respiratory failure. If this infection is in, or if this problem is increasing or extending up to your respiratory muscles, then there will be respiratory failure. Paresthesia of or numbness of hands and feet and pain related to the demyelination of sensory fibers. So you can see paresthesia of hand and feet. Then if it is attacking, if this problem is happening on your optic nerve, then patient will have blindness. So optic nerve demyelination will cause blindness. Suppose if your glossopharyngeal and vagus nerve is getting demyelination or this problem, then you will have inability to swallow. Then vagus nerve demyelination result in tachycardia, bradycardia, hypertension and orthostatic hypotension. So it is the clinical manifestation depends which nerve is getting problem. If your optic nerve is getting this problem, then you will have blindness. If glossopharyngeal or vagus nerve getting this problem, or if it is attacked, then you will have inability to swallow. Again, if vagus nerve is getting this problem or demyelination this problem, then you will have tachycardia, bradycardia, hypertension, orthostatic hypotension. So these are some of the clinical manifestation. Medical management is you have to give respiratory therapy or mechanical ventilation, because patient will have respiratory failure or respiratory muscle weakness. So you have to do respiratory therapy or mechanical ventilation. Then anticoagulant agents or thigh high elastic compression stockings to prevent thrombosis or pulmonary emboli. So you need to give anticoagulant agents because patient will have weakness on the lower extremity, so patient will not move or patient can't move anywhere. So this immobility or patient will become bedridden, and this immobility later will cause pulmonary emboli or thrombosis. So to prevent that, because as you know, if a patient is immobile for a long time, then there will be chance for getting thrombosis and pulmonary emboli. To prevent that, you have to give anticoagulant agents and the thigh high elastic compression stockings. Then plasmapheresis. Plasmapheresis means we will take this plasma outside and we will separate the autoimmune antibody. Then we will introduce this plasma again to patient. It is like we are filtering or separating this autoantibody from plasma, that is plasmapheresis. Then IVIG. IVIG means IV immunoglobulin. So we will give IV immunoglobulin. This is another management, IV immunoglobulin. So these are some of the medical management. Thank you.